So this is a case of a 47-year-old woman who is brought to the ER with complaints of malaise, nausea, vomiting and fatigue. Patient reveals a long history of alcohol abuse for the last 10 years and requires drinks daily, especially in the morning as an eye opener. She denies cough, fever, chills, upper respiratory symptoms, sick contacts, recent travel, hematemesis or abdominal pain. On examination, she appears malnourished but in no distress. Other findings on physical examination are normal. Her blood clot reveals normal WBC but anemia with large RBC. Amylase, lipase and liver function tests are normal. So the key points here are that she is experiencing malaise, which is general uneasiness or discomfort, nausea, vomiting and fatigue. She reveals a long history of alcohol abuse, okay, and there is no fever, cough, chills and there are no sick contacts, recent travel, which determines that this is not an infectious disease whichever she has gotten. No hematemesis or abdominal pain. On examination, she is malnourished, but there is no distress. Other findings are normal. Her blood count reveals normal WBC but anemia with large RBCs, and amylase, lipase and liver function tests are also normal. So we can make an easy flowchart out of this case. There is alcohol abuse, which causes folate deficiency, which causes decreased or deficiency of THF, which is tetrahydrofolate, and this causes this prevents the conversion of TUMP to TTMP, which is important for the DNA synthesis of RBC. Hence there is improper DNA synthesis of RBC, which causes the MCV to be greater than 100. MCV, MCH, these are all parameters to judge the physical or morphological properties of RBCs. Here, since if the MCV is greater, MCV determines the size of the RBC. Here they are improper or immature RBCs being formed, which have improper DNA synthesized in them. Means they are reticulocytes, they are unmatured. Hence it causes microcytic anemia. Here you can see reticulocytes. Now I'll tell you the importance of folate in our body. So it helps in transport of 1-carbon compounds to intermediates during metabolism. It helps in DNA synthesis in RBCs, basically conversion of TUMP to TTMP. Okay? And its deficiency in the body is a major cause of megaloblastic anemia. Megaloblastic anemia, same, MCV greater than 100, and they are macrocytic or increased reticulocyte count in the body. So its deficiency in pregnant women can lead to neural tube defects, which is improper maturation of the neural tube to form the spinal cord in infants. Encephaly, which is an improper formation of skull, which protects the brain of course. And spina bifida, which is the improper development of meninges around the spinal cord, which makes the spinal cord more vulnerable of the fetus. So how to treat it? 400 microgram of folic acid 3 months prior to the conception, and 400 microgram of folic acid per day just before conception. It is given to mothers with previous history of sickle cell anemia, multiple gestations, Crohn's disease, and if previous fetuses have undergone neural tube defects then. So the treatment for this would be 1 milligram of folic acid per day for 1 to 2 months till there is lowering of the anemia levels in the body. Thank you for watching this video. I hope you learned something about megaloblastic anemia and how alcohol abuse decreases the folate levels in our body, which will reduce or cause a deficiency of THF or tetrahydrofolate, which will cause improper DNA synthesis. Basically there is improper conversion of TUMP to TTMP, and this will lead to formation of immature RBCs, which are called as reticulocytes. Thank you.